In terms of, we were talking with the mayor about there's obviously a crunch on the availability of tests. We were promised a lot of these home tests. That's the federal government has total control over that. They've promised hundreds of millions of tests. I don't know when that's coming, if it'll come. Sending it to people or letting them do that without having to go into a line would probably be the most efficient way to do it. If we had the capacity to buy some, we would have bought some, but we can't. It's all going to be done through the federal government. And so I know that there's been promises made in that regard, and so we will see. We have pushed out from the Department of Emergency Management in the last 6 months over 1,500 requests for tests. We've done 50 in Broward County. Now, because of the limited supply, what's asked for, you got to look to figure out, try to spread it around as best you can, and that's what Kevin has done. So there is a crunch on this, and that's just going to be the reality until we get the federal government to start sending more down. But in the meantime, Dr. Ladapo is working on providing some testing guidance about who should be testing. I mean, you want to test in order to get a clinical outcome, and that has got to be readily available for anybody, particularly our vulnerable populations who are infected. But I think what you're seeing is there's people who go to the drugstore, they'll buy all these tests, they'll go multiple times a week and go to the sites and test without symptoms. That is just going to contribute to some of the crunch that you're seeing. So he's going to work on putting out some guidance to try to say, let's test for a reason, and if you need the treatment, obviously we want the treatment to be there for you, and I think that that'll be something that'll be very well received. So we are ready to go on all this and have been ready for a long time. We do not believe that the federal government should be holding back any more medications. We think we have to offer this, particularly for our elderly population. If you look at Omicron and the profile that we're seeing in terms of the clinical outcomes, it's always been true with COVID that the younger folks were less risk, but I think that's even more true with what we're seeing with Omicron. And it's just like other respiratory viruses. Elderly people are just going to be more, people that have health problems are going to be more at risk from any type of respiratory infection. I think that's what we're seeing with Omicron. So we really want to focus and make sure, and Simone is going to talk a little bit, if you have an outbreak in a nursing home, we are going to send the teams in there to go with the monoclonals, with whatever we can do to be able to help alleviate that situation. And those are the folks that are going to be most at risk on this. The other thing that we're looking at doing, and it's not, the technology isn't where we would want it to be like it would be for, say, distinguishing between influenza strands, but you can sequence these test results to try to figure out if it's Omicron or if it's Delta. When they do the estimates about South Florida, 90+% in Miami, they're taking a subset, they're running that through, and then they're extrapolating out to the whole county. So we think it would be something that if you could turn it around quick enough, if you do have a patient who is high risk, but they're not necessarily showing significant symptoms, if you could get it in a decent time, then maybe okay, it's Omicron. Maybe we will focus on the sotrovimab. If it's Delta, well then we'll do the Regeneron or however the practitioners think makes the most sense. But we do not have the technology right now to where you get tested and then you can determine right immediately whether it is Delta or whether it is Omicron. We would need to sequence that. That takes a little more time, a little bit more manpower, but it's something I've asked Dr. Ladapo to look at, bringing together with some of our treatment sites so that we can focus treatments the best way that we can. But we are ready to go. We're ready to receive, and we will put all of this to good use. You can bet your bottom dollar on that. And to expound upon some of the treatments as well as the testing, I have Dr. Ladapo is going to come up and say a few things. Yep.